Hi, my name is Meagan Berry. I'm a registered dietitian with Northside Hospital's Bariatric Innovation program. I work with bariatric surgery patients, and one of the most common questions I get are what foods to avoid before and after surgery. So today we're going to talk about 5 different types of foods to be cautious with after your procedure. First is going to be sugary beverages. So things like a regular soda, sweet tea, fruit juices, or coffees with flavored syrups can add up calories very quickly. A standard size Coke will provide about 65 grams of sugar, and a pumpkin spice latte from Starbucks will give about 50 grams of sugar. The American Heart Association recommends limiting your added sugar intake for the day to 25 grams or less a day for women and 36 grams or less a day for men. So it's not that everything only can be plain water when we're looking to hydrate for the day. You can also incorporate water infused with fruit, different drink mixes like Crystal Light or Sweet Leaf Drops or Mio that's sugar-free. Second, we're going to talk about alcohol. So we try to avoid alcohol for the first year after surgery for several reasons. One is that alcohol is very calorie dense. It gives you about 7 calories per gram, which is almost twice the amount that you get from carbs and protein. A standard shot size will give you about 100 calories just from that, and that doesn't include the drink mixers. In addition, with having changes to your GI tract from the surgery, it does change how you process alcohol. So some people do feel like they feel the effects a lot faster, or that it stays with them longer than it did prior to surgery. The last reason we want to be careful is because of something called a transfer addiction. You may lean towards alcohol for comfort or coping, and that is something we want to avoid with having changes to your food. Next is fried foods, chicken nuggets, calamari, mozzarella sticks. All these things are breaded and usually cooked in a frying oil like butter, coconut oil, shortening, and that can contribute to additional calories as well. With having changes to your digestive process, it puts you at risk for something called dumping syndrome. So you can have like nausea, vomiting, diarrhea, or stomach upset if we have things that are very greasy or fried. Instead, we would recommend preparing your food in a different way. Maybe we're baking, roasting, grilling, or air frying instead. Next will be some of our slider foods. So those are things like crackers, pretzels, popcorn, foods that are very light and airy and they go down very easily. We just want to limit it where it's not something we're doing every single day, but definitely you want to portion control it. Lastly, we're going to talk about some of our desserts. So it's not that we can't have a sweet treat after surgery, but we want to keep it to just a couple times throughout the month because you tend to get both added sugars and saturated fats with dessert. And so not only could that cause the dumping syndrome reaction, but it is a lot of calories at once. If you are preparing your own dessert, we can tweak the recipe. So something you could do is adjusting, instead of having regular sugar, maybe we're using a sugar substitute. To summarize, bariatric surgery is a very powerful tool to help you throughout your weight loss journey. At Northside Hospital, we have outpatient dietitian services to help you throughout your health journey, whether it's with meal planning or reaching personalized nutrition goals. I'm Meagan Berry with Bariatric Innovations. For more information, please go to northsidehospital.com, and thank you for watching.